So one of the first things that we have to discuss when making these alginate impressions is patient positioning and selecting the right tray size. So downstairs in the clinic we have these blue stock trays. We have maxillary trays, and those are numbered 1, 3, and 5, with 1 being the larger and 5 being the smaller. And then the mandibular trays are numbered with even numbers, and again with the smaller number being the larger tray. So the tray size is important because you want to make sure that the tray fits comfortably in the patient's mouth. Sometimes if the tray is too big, it may induce a gag reflex in your patient. Or if it's too small, like you see in this picture here, you may have certain areas in which the tray is showing through in the impression, and you know you haven't seated it correctly in the patient's mouth. So this next clip is from my fix instructor here at ASDO, Dr. Rick Smith, and he's going to show us how to position ourselves when making these impressions, and also some principles to look at when selecting the appropriate tray size.
The first thing that we need to do is to position the patient so that he's at a comfortable position for you to make your impressions. So I'm going to put Pedro at a position where my elbows are at a comfortable position at 90 degrees here. And I'm going to recline him slightly so that I can look into the mouth. So first thing I need to do is put some gloves on. And it's important that you're able to look into the mouth and see all of the anatomical landmarks that we have to capture in the impression. So I like to use 2 mirrors when I do this so I can retract his lips and see everything I need to. Open wide, please, Pedro. We need to capture all the way to the hamular notch here, and also to the vibrating line. Pedro, say ah. The vibrating line is here where the soft palate and the hard palate meet. Once we have looked in the mouth and decided the extent of the tissue that we want to capture, we want to select a tray that will fit within his mouth. Now, in order to do this, it's easiest to use the mirror with retraction with your left hand and use the tray and go in and slip it in. And we want to look in there and make sure that we're covering all of the teeth and have a space about a 1/4 inch on each side of the space of the tray between the teeth. And then we want to make sure that it extends the full length, open wide, Pedro, the full length of the teeth on either side, as you can see here. When the tray, the plastic tray, doesn't adapt properly, you don't have enough space, usually laterally on the teeth, and there are a couple of techniques you can use to give yourself more space. One is you can heat the tray and actually bend out the buccal flanges a little bit on it. You just heat it, as you can see here, with an alcohol torch, and then you can just bend it like this, and the tray will bend out, as you can see. And you could do that on both sides as you need it. The other technique is to use a larger tray than you would need, but it might be too long, and then you can just cut that off with a burr. And in Pedro's case, these trays are pretty well suited to him, but we can flare them out just a little bit like that, and it gives us a little bit wider tray. So that's kind of the beauty of those. Once you've stretched them out to where you want them, then we can chill them with some water, and we're good to go there.